Hello there. I'm here today with Alastair Bell, Executive Vice President for BMC's Health System, who for the past month has led our surge planning efforts, among other things. So Alastair, before we get into the BMC specifics, this is obviously a global pandemic. Could you talk a little bit about what we learned from places around the world informed what we do here at Boston Medical Center?
I think we looked a lot initially at China and Italy and learned probably three things. The first was we just understood the epidemiology of the disease and what it would look like if it escaped public health control. The second was the importance of the acute care response. China implemented pretty extreme public health measures early, but I think what was less covered was just the magnitude of their acute care response. And I think what we saw in Italy was really the full impact of the disease overwhelming a healthcare system. The third thing that I think we learned, you couldn't not learn it by hearing the stories coming out of those countries, was just the impact that this epidemic was having on staff and people working on the front lines in healthcare, whether that was from just dealing with the sheer magnitude of cases through to really tough decisions around allocation of care. And I think for all of us, we spent a lot of time thinking about how do we prepare to support our staff, to do our best for our patients, but also to help prepare us when we potentially get into much tougher times and having to make some really difficult decisions.
So you've talked about planning our acute care response. What were the elements that you looked at? There's so many things you could focus on. How did you kind of take the universe of ideas and the universe of information out there and distill it to essential facts that we needed here at Boston Medical Center?
I think when you look at planning for a surge of disease like this, there are two key elements to it. The first is prediction. And that's absolutely fundamental. It's making some assumptions with best available evidence and trying to guess at what's going to happen. You can almost be sure that you're going to be wrong, but it really helps frame the order of magnitude of what you're trying to prepare for. The second thing when you come to surge planning is really around alignment of resources. So it's aligning beds, staff, primarily physicians, although not exclusively, primarily physicians and nurses, ventilators, and personal protective equipment. So, for example, having a bed with a physician and a ventilator, but no nurse, doesn't work. Right. So, partly it's about looking at those different dimensions of resources within our system and trying to pool plans together for each of them so that we can deliver as much care to as many patients.
That's terrific. Say one more bit about the details. So you and your team have built a model that models how many gloves we'll need through the course of this pandemic. Could you just take a minute on that?
Yeah, sure. So the issue of PPE was, I think, really has been maybe the issue that we've wrestled with through this. How do we keep our staff safe? We know that if we run out of it, then our staff will get sick, and that will fundamentally compromise our whole surge approach. So we've tried to model out essentially how much personal protective equipment we would need over the whole duration of the epidemic. I think it's important to know that this is really different than how normal supply chain works. So normally a supply chain would look at how much we have in-house, our inventory, how much we are using, and how much we may get in through deliveries. What it doesn't account for is the surge in demand above normal. And so looking at what you used last week and saying, okay, we've got enough to last 10 weeks, this won't work. You have to look ahead of it. And that's where the prediction piece comes in, which says, actually, you're going to need over 10x the amount of PPE if we're going to make it through. So it's sort of pulling together the analytic part of it and then trying to align that with our operational plans.
Thank you, Alastair. And I want to thank all of you for tuning in today.